Well, it's been a while, everyone, hasn't it? So I guess some of you have noticed that until I released my Northanger Abbey video last week, I hadn't done a video for like 6 months. And, well, there was a reason for that unplanned hiatus. Namely, I got severely burned and was in the hospital and then in a very long and complicated recovery because, oh yay, pre-existing conditions are a thing. So I thought maybe I'd like to tell the story of what happened, and while I'm at it, I thought this would be a great opportunity to kind of have a fun narrative experience where we can learn something about burns. So I'm going to tell my story. I'm going to have some tips for what to do if you ever find yourself in a situation like mine. I've got links to burn organizations below and medical reports and stuff like that so that you can learn more about burns, because I'm clearly not a doctor. So I'm not doing this with any sort of medical authority. These are just things that I've learned from doctors and nurses and info that I've got from these links below. So anyway, sit back, relax, get out some tea, and let's go into what happened. I think I mentioned in my first Northanger Abbey video that I was supposed to be in an online play of Pride and Prejudice back in August. So the day of the performance, I was in the middle of a heat wave where I live. It was supposed to get up to about 100 degrees Fahrenheit, which I believe is about 38 degrees Celsius for people who live outside the United States, which is not only really hot, but very abnormally hot for where I live. That generally doesn't get above like 80 degrees Fahrenheit even in the summer. Don't know what that is in Celsius, but I'll convert it and I'll put it down below. So not only do our houses not really have air conditioning, we don't really have insulation in our houses to deal with the heat. So on the freak occasions when it gets that warm, which is becoming more often because climate change is a thing and it sucks, and on a hot day it just gets really hot inside. So I was kind of worried that because I was going to be in a play where I was going to be in Regency men's attire, which means I was going to be up to here with my collar and cravat plus a waistcoat and a tailcoat, I was just going to die of heat stroke or something. So I decided I was going to get up early in the morning and make iced tea by making a big pot of hot tea and waiting for it to cool off. So I boiled the water and I poured it into a big glass container to make iced tea. Unfortunately, I did not realize that the glass container was not heat safe. So I heard this sickening crack. The thing broke in two and all that freshly boiled water splashed down onto my right thigh and a little bit of my lower abdomen, but mostly onto my right thigh. I screamed bloody murder. Like, I think my neighbors actually think I murdered someone, and I'm really glad they didn't try to report me to the police. I didn't even realize I could scream like that. Everybody else in the house was asleep, and I think they were just kind of in their beds going, oh my God, what's going on? I don't know what's going on. But anyway, I immediately realized it was serious. Oh, here's my first top tip. Actually, I'm gonna call these hot tips because I think since we're talking about burns and I'm trying to keep it light, I'm gonna go for the low-hanging fruit of the joke. This is gonna be hot tip number 1. If your clothing gets wet with a superheated liquid, get it off your body ASAP. Because if you keep the superheated clothing against your skin, it's just gonna burn it worse. But anyways, I knew the burn was serious and I needed help, so somehow I hobble over to the bedroom and I wake up my husband and he gets me onto the couch laying down with my leg elevated while I try to figure out what to do. Hot tip number 2, don't do what I did, which is do not put ice on your burn because it can actually make the burn worse. If you get burnt, no ice, wet washcloth at like a coolish but not super cold temperature. So anyway, here I am, laying on the couch, on my phone, trying to look up how severe my burn is so that I can figure out whether or not I need to go to the doctor. Because it was a weekend in a pandemic and I really didn't want to go to the emergency room. Yeah, no, hospitals in pandemic, not a good thing. I was, desperately looking up information about if my burn was severe enough that I needed medical attention. They describe burns as being either 1st degree, 2nd degree, or 3rd degree. And your skin is kind of divided into 3 layers. There's the epidermis on top, there's the dermis in the middle, and then there's the subcutaneous tissue underneath. So a 1st degree burn, only the epidermis gets burnt, so it's considered minor or superficial, like not a big deal. In a few days or maybe a week or 2, it's gonna grow back just fine. 2nd degree burns is when the burn extends down into the dermis, and that can be a little more serious. Like small ones, not so serious, but one my size, it's a lot more serious. And then 3rd degree is when it's gone through the entire dermis and epidermis, and in those cases, it's usually when you need skin grafts. So I already knew a little bit about burns in the past because about 10 years ago, right out of college, I was working at a tea shop. You wonder why this channel is called Tea with Cassiane? Yeah, tea is a recurring theme in my life. Anyway, while I was working at the tea shop, I got a hot water burn on my arm on a very busy day when things were a little chaotic, on my wrist. And it was 2nd degree, and it was just bad enough that I had to go to the ER. And the closest hospital, because hey, I live in the Bay Area, and at the time I was living in Silicon Valley, the closest hospital was Stanford Hospital, which you would think, oh great, yeah, they would totally know what to do for burns. Stanford Hospital does not have facilities to treat burns because, and this is my 3rd hot tip, most hospitals don't have burn units. So always make sure that you know where the closest burn unit is in your area, because otherwise what's going to happen is you're going to sit through the emergency room, you're going to see a doctor, and they're going to tell you to go to the hospital that has the burn unit in it. If you're trying to determine at home whether or not you should go to the doctor, the 2 things you want to consider are the size of the burn and the severity of the pain you're in. And I forgot to say, the 3rd thing you want to look out for is where it is on your body, because if it's on a sensitive area of your body or a major joint, you also want to go to the doctor. The whole reason I had to go to the doctor for my wrist, even though it was a fairly small burn, is because they were worried about scarring on my wrist, making it so that I didn't have as much mobility. They were saying if the burn is bigger than 3 inches, you should get it looked at. This is a lot bigger than 3 inches. So yeah. And the pain was horrible. I'm a klutz, so I've been injured before. I've been in bad pain. And this was like way beyond it. Like, you know how when the doctor's like,
on a scale of 1 to 10, how would you rate your pain?
And I'm always like, what does that even mean? Hey everyone, I just wanted to stop here and talk a little bit about pain scales because they've changed a lot from when I was younger. When I was a teenager, when I went to doctors, they would give me a pain scale that looked like this. And this is pretty vague. I honestly wouldn't know how to answer that. Now, the pain scales I see look more like this. It's very specific for every number, and it's very easy to classify the type of pain that I'm feeling and say yes. So like for this burn, I was definitely a 9 on this scale. This was the worst pain I'd ever felt in my life. It was truly horrible. But I still really didn't want to go because of the pandemic. So in order to have like a clearer perspective, I decided to call my mom and talk to her. So I called her and I'm like, hey mom, this is what happened, and like I'm trying to figure out, should I go to the doctor? Like, should I go to the hospital? Do you think it's bad enough? And she's like, are you kidding? No, go to the hospital. That sounds awful. So despite the fact that I live like 5 blocks from my local hospital, like it's literally just down the street this way, I had to explain to Chris that, no, we're not gonna go to the nearby little ER. We're going all the way to San Francisco because that's where they have the facilities to treat burns. So packed ourselves in the car and took a nice little drive over the Bay Bridge. So we get to the hospital, and because it's a pandemic, I have to go into the ER alone, which was fun because at this point my body has gone full on into shock, like trembling, shivering, heart fluttery, and I can barely walk. And like I'm tearing up at the effort to get in. But fortunately there was nobody there because A, pandemic, and B, it was still very early on a Saturday morning. So they got me in right away. They put a nice cold cloth over the burn. So the doctor finally comes in and he looks at my leg and he said, "This is what I strongly recommend. You should be admitted to the hospital immediately, and tomorrow morning, as soon as possible, we're going to operate on the leg, and you'll probably be in the hospital for a week." They want to operate so that they can remove all the damaged dead skin from the burn, to give the skin underneath that's left the best chance of recovering. And then they want to cover the wound with kind of an artificial skin that will protect it from infection while the skin underneath is growing back. And I'm sitting there and I am in shock. Like, I never in a million years thought the burn was bad enough to need surgery. I had second-degree burns, but almost the entire dermis was burned. So it was very close to being third-degree burns, and burns can sometimes get a little bit worse over time, the first few days after the burn, if you don't get it cleaned up and taken care of immediately. And I'm freaking out at the thought of being in the hospital for a week because this was during the pandemic, and from what I'd heard, they weren't allowing people to have visitors in the hospital. And the thought of me not being able to see my family for a week while I'm undergoing all this surgery and awful stuff like that just seemed really kind of not something I wanted to deal with. I also usually, because I've got pre-existing medical conditions, which we're gonna go over in a minute, it's not my first time in the hospital. So usually when I am in the hospital, there's some sort of big thing going on. I like to have a family member as like a medical advocate who knows my medical history really well and can ask the questions that maybe I'm not quite prepared to ask myself, and can stand up for me if something's going on that, you know, doesn't seem to be the best choice for me given my circumstances. And so the thought of like having to go through all this without a family member advocating for me, also really scary. So I tell the doctor, "Can we please not? Like, is there any way around this?" And he was saying, "Well, I mean, you could, technically, but it would be a much longer recovery process. The chances of the burn advancing to third degree are much higher, and then you would need skin grafts. And because my pre-existing medical condition is that I have lupus and celiac disease, both of which are autoimmune conditions, you know, there's a very high chance of complication from infection unless we get this cleaned up quickly. And those all really hit home to me. I have experienced that in the past on more than one occasion where, you know, I have infections complicating because my immune system doesn't work. So I get to have this really fun phone call where I call Chris and I tell him that, yeah, you know how I thought we were just gonna get some burn cream and go home? Well, they're gonna keep me here for a week and they're gonna do surgery in the morning. Yay! So I had Chris contact my director for the play I was supposed to be in and say, "Hey, well, I mean, Cassie's not gonna make it because she's in the hospital with severe burns and she's having surgery in the morning." They were all so sweet. They sent me a big bouquet of flowers. Not that I could have them in the hospital because pandemic, but you know, they sent them to the apartment so I got to see them when I got home. But they were so sweet, and they even postponed the whole production of the play until I could get better, which they totally didn't have to do. I was playing Mr. Collins, by the way. So anyway, they admit me. One fun thing is that the last time I had been at that hospital was for 10 years ago when I got burned. So they had me in the system under my unmarried name. It's Greek. I'm Greek American, so my last name is very Greek. I took Chris's last name, mostly because my last name is really hard to spell. But I also, like, really kind of miss sometimes, like, the recognition of, oh, hey, you're Greek. That's a Greek last name. The doctor immediately looked at my name and was like, oh, hey, that's a Greek last name. You must be Greek. When the lady was admitting me to the hospital, she was like, oh, cool, you're Greek. Like, and apparently she was Greek too. But anyway, that's kind of a digression. What's most important is that, you know, I got admitted. They wheeled me up to the burn ICU unit and got the burn properly wrapped and dressed and, you know, just kind of waited for surgery in the morning. The burn unit there, it was really state of the art. They had just renovated it a few years ago and they had a lot of cool gadgets, which I'll describe a little later. But yeah, no, that place was amazing. And everybody in there was so sweet. It takes a really good disposition to have to deal with people who are in that sort of pain. The other thing that they told me was that, you know, they want me to eat lots and lots of food because when you're trying to grow back that much skin, you need a lot of extra calories. So they're like, okay, so like, see if you can get some takeout, like in addition to your hospital food, because you need like twice as many calories as normal. I had Chris come bring me takeout every day because, and I forgot to say this earlier, they told me that their hospital was allowing patients 1 visitor per day for 1 hour. So even though like that doesn't seem like a lot, like just getting to see my husband for 1 hour a day was such a relief. And he was gonna bring me yummy takeout. So, I mean, like, I'm still in bad shape. This was still really awful, but small silver lining? Little glimpses of silver up in the clouds. Yay. Where was I? All right, so, you know, prep for surgery in the morning. So the next morning, the first thing they do is they need to clean the wound before surgery. So I got to have a bath in their cool state-of-the-art bathtub for burn patients because with a burn, your skin is very, very temperature sensitive. So they have this cool tub that's precisely calibrated to human body temperature. And, you know, they very gently, they kind of put you on the stretcher and like lower you into this very tightly controlled temperature of water. And they were so sweet about it. And they washed my hair, which was great. And I wasn't going to be able to have it washed for another few days because on bed rest, so it's very hard to bathe. But one thing I will say, because every other time I've been in the hospital, I've had long hair and I have this nice short hair. And short hair in the hospital, oh, so much better. A+, would do again, except I don't ever want to be in the hospital again. I had my bath, they wrapped me up again, and then I got to talk to the anesthesiologist before surgery, which I was really excited about because one of the reasons I was scared for surgery is that I react very badly to anesthesia. Like, I'm talking like 2 days where I could barely keep my eyes open and they had to keep me in the hospital an extra day because they're like, she's having a bad reaction to this. So I told all this to the anesthesiologist and he was so sweet and he was like, okay, I get why you're nervous and like, I've seen people who have that sort of reaction before and I think that we have something that can work with that. And so that made me feel so much better. I will say for this hospital that like all the nurses and doctors make you feel so listened to and like, you know, they make sure that you're fully informed for every step of your treatment and all the meds that you're going to be taking and every procedure that you're doing. So you feel very in control of your medical care. And I really appreciate that because it can be so overwhelming when you're in the hospital. So anyway, they wheel me into the surgery and I wake up about an hour and a half later and it was so easy coming out from that anesthesia. Like I was barely groggy at all. I was a little tiny bit groggy the rest of the day, but it was nothing compared to what I had had for my last surgery. It was so gentle. Like, A+ anesthesiologist, would do again. Only I never want to have surgery again. Also, like, my doctor came in to check on me and he's like, by the way, when we gave you the sedative, you were really charming under a sedative. And I'm just like, okay, what does that mean? From what I've heard, like, people under that sort of a sedative, they kind of act like they would act if they were drunk. Apparently I'm charming when I'm drunk. Does that mean I'm erudite? Does it mean I'm silly? I don't know. Apparently I'm charming. What does that mean? And so they keep me down in the burn ICU for another 24 hours just to make sure that I don't have a weird reaction post-surgery and that I'm stable. And then they move me up to a regular hospital ward because they need the ICU beds for other burn patients. And the first thing that I notice when they wheel me out of like the very tightly controlled, air-filtered ICU environment is that it smells like a wildfire in there, because the night of my surgery was the night of the freak lightning storm in California where almost the whole state caught on fire. So the air quality was terrible, and I spent the rest of the week breathing in smoke fumes because the rest of the hospital was definitely not airtight or air filtered. They had me kind of stay on bed rest for about 3 days, and then on the third day, they took me back down to the burn unit to change the bandages, which, by the way, is a thing, because burns are so painful. You can imagine, like, just touching the wound is really, really painful. Like, it made me jump out of my skin. So, like, I had to take pain medications, and I hate pain medications, but I had to take them just so that they could change the bandages. And by the way, like, they were being so very gentle changing those bandages, and it was still excruciating. Like, I can't explain to you how slow and how gentle, and, like, you know, if you even winced, they would stop because they didn't want you to be in pain. Those nurses were so good, but I still needed pain medications. I bled from the surgery longer than most people do because it's one of the side effects of my conditions is I bleed a lot. So I was a little nervous about that, but the doctor was like, okay, no, it's like, this is kind of what we were anticipating for someone with your conditions. So, you know, as long as the experts are okay, I'm like, okay, I'll get through this. So after that, they changed the wrappings every day until the wound stopped bleeding, which took about a week. And then they were ready to send me home. But before they could send me home, they had to teach me how to use crutches so I could get up and down the stairs to my apartment, because we live on a second-story apartment. Because my leg had taken so much longer to stop bleeding than most people, I think I was like several days behind in the healing process compared to what they were used to, because I could not use the crutches. Like, as soon as they put, you know, stopped elevating the leg, it swelled up like a balloon, and it was incredibly painful. The one thing about the artificial skin they had put on it is that it wasn't stretchy like real skin, so like when there was inflammation, it would feel like someone was tugging on it, and it was really painful. I tried it and I'm like, no, I cannot do this. And the physical therapist, by the way, he was an asshole. And I usually don't swear on this program, but this guy was an asshole, because I was in horrific pain and I said, I cannot do this. And he was saying, oh, it couldn't possibly be that bad. You should just take pain medication, get over it. Don't be a wimp, you know, just suck it up. And I did not want to take pain medication because I didn't want to not be able to feel what was going on with my body and like injure myself worse because I was on pain medication, which is something that happens. So I said, no, I don't want to take pain medications. And he basically forced me to take that, or he threatened I wouldn't be able to go home. So here's another hot tip. You have the right to refuse any treatment. If you feel like somebody on the medical team is not treating you well, you have the right to speak to their supervisor. I should have done that. I was just really not in a good headspace and I wanted to go home so badly. I said to myself, fine, I'll put up with this if they'll just send me home. But he was literally gaslighting me about my pain, and that is not okay. That is absolutely not okay. He was minimizing my pain when I know my body way better than he could ever know my body. And it's not okay to shame a patient like that. And by the way, even with a full dose of pain medication, I was still in horrific pain with my leg down. That should not have happened. That should not have been okay. And I immediately realized, no, I'm not gonna be able to get around on crutches. So what they basically did was like wheelchair me down to the car, put me in the car, we drove home, and then like I was met with a wheelchair on the other end, and Chris, bless his heart, because we live on in an old Victorian house that was broken up into flats, and we're on the second floor, so it has one of those like old, really steep Victorian staircases. And he carried me up that long, dangerous staircase by himself. He is my hero. I have a really good spouse, people. Like, amazing guy. Yeah, carried me up the stairs and deposited me back in my home sweet home apartment like a baby. And then it was just me settling into a long outpatient process. So I was going back to the clinic twice a week to make sure everything was going well. It took another couple of weeks for the wound to close up, but then I had a new layer of skin growing back that was, you know, kind of pink and new looking, but it was my own skin. And like, I don't think I've ever been like happy to see leg hair on my legs, but like when I saw that the skin that was growing back was starting to have a little bit of hair follicles had grown back, I was like, oh hey, it's gonna be real skin again. Never thought I'd be excited about leg hair, but there we are, leg hair. So, you know, once the wound had closed on, I still had to do compression wrapping on it, and then they ordered me a compression garment to wear on my leg for a few months because the compression would keep scar tissue from forming. I still had to grow back like nerves and hair, and like not just the skin, but the tissue underneath the skin had been damaged from the burn. So like you could see some scarring under there where that was having to repair itself. And the compression garment not only kept the pain down, but one of the things that happens when a burn is recovering because your nerves are growing back is you kind of have this sensation of pins and needles creeping up and down your leg, and it can feel annoying, itchy, you know, just like you want to, it's not a fun thing. And the compression garment helps with the pins and needles sensation while the skin is healing. I didn't describe this when I was in the hospital, but like the sensation of that raw skin, because the nerves hadn't grown back yet, like it was very weird with temperatures, and like it would start shivering even if the rest of me was warm, or it would feel warm when the rest of me was cold. It was not a lot of fun sensations, but like that's something that I was dealing with. Once I had my compression garment, I didn't have to go to the burn clinic as often. And as of this month, you know, I don't have to wear the compression garment anymore. And, you know, I don't have to go back for a few months for another check. So anyway, it looks like that when the leg heals, the skin where the burn was will always be a slightly different color. And it may be slightly more susceptible to sunburning. So they want me not to go in the sun with it, which it's fine with me. I mean, I knew I was never going to be a swimsuit model or like a pantyhose model or anything like that. So, hey, fine with me. Could be a lot worse considering everything that went on. But anyway, so some of you might be wondering why it still took 6 months before I started editing videos again. Let's just say there were complications. To start with, I tend to be slightly anemic anyway because medical conditions, plus I have polycystic ovarian syndrome, so you know, even with medication for that, I tend to bleed a lot every month. But Yeah, because I bled so much from the surgery, I went from being a little bit anemic to being super anemic, like super Grover. And, you know, I had to kind of build myself out because I was really run down from that. And, you know, they were kind of afraid that my autoimmune conditions were going to flare up from the trauma, which is totally understandable because, you know, autoimmune diseases get triggered by inflammation. And so I ended up having an autoimmune flare up, feeling really sick from that, and then having all the complications of having a suppressed immune system. So then I started getting weird secondary infections. That was so much fun. Oh my gosh, it took us like 3 months to deal with all the weird secondary infections I was getting from no immune system. And then on top of it all, I got pretty bad depression. Oh my gosh, like all these things happened to you and you got depressed? I can't figure out what you would possibly have to be depressed about. But yeah, I had to get some medication for depression. So everything is slowly returning to normal, and I'm hoping to be back on a regular filming schedule as of now. And I've got a lot of exciting projects I want to try, and hopefully everything will be good. So thanks for sticking with me through this long story. Check out my links about burns in the description, because there's some great information so that you can be prepared in case something ever happens. Because hey, we all have to cook food, we all have kitchens, and we can get burned from that, literally and metaphorically. If you enjoyed this video or found it useful anyway, give us a like, subscribe if you haven't. We also now have a Patreon. So, I mean, if you're a fan of my Jane Austen on Point series, those are very heavily researched videos, and they take a long time both to write and to edit. They take a long time to edit. So any donation that you can give us to help produce those videos and keep it free for those who can't afford to give, that would be lovely. And hopefully I will see you all very soon. Take care.